The listening part of occupational English test has 3 parts, and in each part, you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mrs. Breegi. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. May I know your problem?
Well, I have headache. The headache first began 2 months ago. I feel a sensation of pressure. The intensity is moderately severe, making regular activities difficult. I fear I am getting much closer to sinus congestion, or maybe photophobia.
What's your age?
42, doctor.
Do you drink or smoke?
Well, I do not smoke, but I drink regularly.
Tell me if any of your family members have any history of illness.
My father and brother have a history of migraine, doctor.
Is there any congestion in your chest or throat?
Yes, I have some sinus congestion.
Did you have any cardiovascular problems?
No, doctor.
Any gastrointestinal problems in the past or present?
No, doctor.
Are you taking any medications?
No, doctor.
Are you allergic to any medicine?
Yes, codeine.
Do you have any muscle cramps, joint pain, back pain, or limb pain?
No, doctor.
Do you have any musculoskeletal problems, or in the past?
No, doctor.
Well, the sense of smell of your cranial nerves was intact. Neck range of motion was normal in all directions. There was no evidence of cervical muscle spasm. No radicular symptoms were elicited by neck motions. Shoulder range of motion was bilaterally normal. There were no areas of tenderness. Tests of neurovascular compression were negative. There were no carotid brutes. Back range of motion was normal in all directions. Position and vibratory sense was normal. Your gait has no abnormal components. Tandem gait was performed normally. There is no edemia or significant varicosities. You have developed migraine without aura. I am going to describe therapeutic trial of Inderal 40 milligrams, half tablet twice a day for 1 week, then 1 tablet twice a day for the next week, and then for the 3rd week, 1 tablet thrice a day. Continue these medications for 3 weeks and meet me again after 3 weeks. Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mrs. Crome. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. Please be seated. May I know your problem?
Well, I feel that I have jaundice and a pancreatic mass, and recently I've noticed a new murmur, bacteremia, and fever.
What's your age?
64, doctor.
Okay. Do you have a cardiac history, or else any shortness of breath called orthopnea, or attacks of severe shortness of breath and coughing at night called paroxysmal nocturnal dyspnea?
No, doctor.
Are you getting chest pain, palpitations, or syncope?
No, doctor.
You have any past medical history?
I had diabetes, hypertension, and transient ischemic attack long back.
Okay. What medications are you taking?
Acidophilus supplement, cholestyramine, Creon 20 3 times daily, Diovan 160 milligrams twice daily, Lantus 10 daily, Norvasc 5 milligrams daily, Novolog 70/30 10 units at noon daily, Pamelor 15 milliliters every evening, vitamin D3 1 tablet weekly.
Are you allergic to any medication?
I'm allergic to codeine, Coreg, and vancomycin.
Is there any family history of illness?
While my daughter has a history of a murmur, my father died when he was 75 due to chronic heart failure.
Okay. Well, your laboratory data shows sodium 133, potassium 2.8, chloride 99, bicarbonate 31, glucose 75, BUN 12, creatinine 0.8, calcium 8.6, total bilirubin 3.2, AST 63, and ALT 43, white count 5.4, hemoglobin 9.1, hematocrit 26.6, and platelet count 128,000, lipase less than 10. Your abdomen CT diagnosis shows a pancreatic mass with biliary obstruction. Previous biliary stent is present. Your electrocardiogram shows normal sinus rhythm. There are no acute ST-T changes. Your temperature is 98.8, heart rate 96, sinus blood pressure 138/55, respiratory rate 20, and oxygen saturation 92%. You have newly developed murmur that has occurred in the setting of fever and bacteremia. You also have a pancreatic mass with jaundice, hypertension, hyponatremia, and hypokalemia. Take Diovan and Norvasc for blood pressure control. I recommend that you should undergo an echocardiogram. This will be to assess the possibility of endocarditis, which may be contributing to these symptoms. This is the end of Part A.